Hi, I'm Nancy Hireman. This is Brenda Kazire. We are the authors of the Hospice Care Plan, A Path to Comfort. You have it in your hands. We're really excited that you're going to use it. And so we're going to do a video right now to help you understand how to get the absolute most out of the booklet for your staff and your patients so that your investment is utilized.
And we call it our tips for use. And the first tip is that read the booklet, become familiar with it. It only takes 20 minutes to read from top to bottom or front to back. And I'm always amazed every time we go to do an update and I read a section or I'm reading it to a family, I think, oh, there's a lot of information here. It's really good. And I think it's important to note that this isn't going to prescribe your care. You're still going to use your own style, your own words, but so much of the work has been done for you. And I think it's fair to say that the seasoned hospice nurse is going to use it a bit differently than the newer hospice nurse. Our medical director, she, with the newer nurses, when they call with questions, she goes, have you read that section? Have you read that section to the family? So,
And once you familiarize yourself with the booklet, you've got to go to the Care Plan YouTube site because you'll need to familiarize yourself with all the videos that are there. We add a new one almost every day. They match the playlist. The playlists on the YouTube channel match the sections in the booklet. And we do, again, make videos regularly. I continually learn from Brenda and her videos. We learn from each other because everyone is individual and we approach our own practice in a different way. And sometimes I think, oh my gosh, that's a great way to say it. And so, again, learn from us, learn from each other, and make sure you know how to get those videos in the hands of your patient.
so what's great in our fourth edition, and we have a sheet. So every playlist has its own QR code. And in the fourth edition, it's embedded right in the booklet. You can just go to the QR code and it takes you right to that playlist.
Okay, so now you have the booklet. Hopefully, you might have one in front of you. You want the booklet to be in your admission packet so that you can start using it directly at the beginning of the admission. Whoever it is, the nurse, the social worker, whoever's doing it, it's really especially helpful if you fill out the contact page as much as you can before you enter the home. Then, when you start talking with the family, they can help you fill in all the details of the family members, the point people, and so forth. And that actually helps you bond right away to the patient. You find out a little bit more about their social makeup and their family constellation.
So the introduction is important because it introduces the four C's. And what is that? We ask the question, are the four C's being met? Are they calm? Are they comfortable? Are they clean? And are they cared for? And throughout the booklet, on the individual section, it asks that question because sometimes you just have to stand back and ask yourself. We sometimes get wound up in what we're supposed to do, and just it takes you back to the basics. And so that it introduces that. And then it also goes through and it describes everybody on the hospice team and what their roles are. And it emphasizes that it's a team approach. And that's really important. So they understand now who's on the team and what to expect. And I really like the section. What do you need to know about end of life? It talks in real gentle language about, you know, what you need to know that dying is normal. And and it also, it's at the introduction, it also leads into the YouTube channel and the playlist.
One of our, I think, the jewels in the book is that first page that's about the dying body. We really took a lot of care of telling people so that our families are not overwhelmed by hospice and they're wanting to know if this is normal or abnormal. So, about the dying body really just is gently saying that it is in our DNA. We knew how to grow and be birthed, we know how to die. And then we all know, if we're on the hospice team, that families are really always a little bit, even a little shy of asking how much time is left. So we really address that. We want our clients to ask us the hard questions. And so oftentimes, this is a really good one to read through with your patient right from the start, your family member, and your generally the family members, so that they feel that this is organic, they understand what's going to happen, and it helps them to relax a little.
So also, I think it's important that, you know, you have good instinct. You know that some hospice families you go into, you can't even use the word hospice. They're not ready to hear how the body dies and how much time is left. You're going to know when to go to that section.
We have a really nice section on how to set up medications. You know, families they may be doing a good job. If they are, that's great. But we do have a section that really talks about the importance of medications, how to set up a very safe place for medication management. But what's really exciting for me and Brenda, and it will help you, is that there's a spot to write in all the scheduled medicines. We always use a pencil because you know those dosage and times change all the time. The PRNs, and then they actually can write down exactly what they've used PRN, and then of course what's the bowel tracking. So that's a really valuable tool. And once you've filled out all those medications, take a picture of it, and then you can, when you sit down with your computer to put it in your EMR, you'll have it right there. You won't have to remember.
So, and I'm going to stress again about this section here on how to document PRNs and the bowel movements. This is a huge time saver, and it gets you to improve symptom management much quicker. You know what PRNs are being given. You get a sense of, are they using the routine medications to help prevent symptoms? And then tracking the bowels. And lots of people have their own system already in place, and that's great. But a lot of people don't track the bowels. And we know that that's so important. So it really saves a lot of time. So I think that another tip that is important is some families, they're information seekers or people, they just see it and they read it front to cover. Others are like, yeah, that it was, you know, with everything else, there's just too much to know. Consider just offering one or two sections at a time. Often, you know, we start with bowels. Most everybody comes to hospice constipated, and just reading that section with them, and then they're like, oh, they start to see the value. Whatever section is most pertinent to them,
yeah,
read it
generally,
with them.
right. Generally, on an admission, you're going to have a patient that has 2 or 3 issues that are really primary.
Yeah.
So if it's pain or bowels or whatever it is, those are the sections you want to start with. Don't expect that they're going to pick up the booklet and read the whole thing, as Brenda said, but find those 2 or 3 symptoms and start with those. Put a tab on them. If you don't have sticky notes, then just at least turn the corner over, and that's what you want to really focus on. You don't want them to be overwhelmed.
Right. I think these we would have loved to have put the booklet together with, you know, built-in tabs, but it just wasn't cost effective. And what I like about the sticky note systems, I always keep the one on medication. But for instance, when they're new to hospice, I almost always have the bowel section. But then as things go and their bowels are managed, I take that away and I put in a section on transition. And so that it's not overwhelming, they can go right to it.
And what's really good about having it tabbed is that we actually often ask them, we give them homework, and we say, we may notice, we all know in hospice that we know things are changing and we don't want to frighten them. So we just maybe gently say, you know, that section that we have tabbed under transition, would you make sure that you've read that before I come back? And we're going to talk about it at my next visit. And oftentimes they will then go, oh my gosh, mom is in transition. I'm getting that.
I think what's important about that is so significant. So instead of a family having to pull them into the reality of transition and active dying, when they're able to have read it, see it happening, and they're telling you what's happening, it's just it's a subtle but significant difference in how empowered and less frightened they are.
And again, once that you've introduced the booklet now, you've given them some homework, they're using it for the primary issues, they're going to be friendly with the booklet now. And oftentimes when they have questions, they aren't going to call you in the middle of the night. They're going to pick up the booklet and find what they need in the moment and ask you the question the next time. By the way, mom seemed looked like she was having trouble breathing. So I read the thing on breathing. And then the next visit, you know exactly where to start your visit, what you need to refer to, and how to teach from there. So it's really exciting to see them again when we aren't there. patients still need, or and families still need information. So the booklet becomes the team. It's like, this
Right.
is us when we're not there.
I think it's a good time to bring up the videos again because at 2 in the morning, when you have to change a brief and you don't know how, that's how our whole YouTube channel started. Is we just threw up a video on YouTube channel of how to change a brief, and there's now over 3 million views of that video. And what that says is people need that information.
Yeah, I mean, we know that when we're in the home, we're going to show how to put a draw sheet under somebody or change the brief, and they get
Secure a
one,
catheter.
yeah, secure the catheter. But that's all they're getting is one show demonstration. And when we go away, it's like, how do we expect people in their anxiety to remember all those things? That's why we've got the videos. So you really might even consider what if you're working on a particular issue like catheters, pull up that video right away on their phone. Almost everybody has one these days, and get them friendly with using the videos.
So we get the question a lot, how do we use this in a facility? So many of our patients are now in facilities. And I would say a few years ago, I thought patients in facilities were easier because, there was 24-hour caregiving, but I'm finding facilities have lots of needs and a lot of caregivers who don't have a lot of education in end of life care. So I think what's great about the facility is when I have somebody there, I always give the family a copy and I encourage them to read it, whether it's the whole section, read section with them. Again, what's important and pertinent, but also by having families read the booklet, they then know what to expect for care in a facility, and then they can better advocate for their family for the care that they should be getting.
That's really true. And oftentimes in a facility, I actually give two booklets. One, because the family oftentimes they want to take it home and digest it at home. They don't necessarily read it in the facility, but then we leave it on the bedside right next to the patient so that the caregivers who come in, they can look at it. They also, we all know about how staff changes. There's so many shifts and everything. When somebody walks in, they realize, oh, this is a hospice patient, and that really helps them
Yeah.
to give the care that's needed.
It really sets a standard, like what is expected and if there is care here. In a facility, there's two sheets I keep in my bag, and I print off and I post on the wall. It's like catheter care. When a patient now has a catheter, it's on the wall. I circle it. This is an expectation. Swallow precautions. Proper positioning for swallow is another one. And also we have it in Spanish. In our area, there's a lot of Spanish speaking people, and they love the book. They're like, it's in Spanish, and they really appreciate it. They have that knowledge, and then they know what's expected.
We think you should really consider requesting or requiring really that the hospice team uses the booklet for every patient. They incorporate the booklet into their care plan. It really does help meet Medicare guidelines and CAP scores. When we wrote the booklet, we wrote it based on our own practice. We didn't think about the CAP score evaluation tool, but it was brought to our attention shortly thereafter that it meets all of the questions. So
Yeah.
this is really going to help you improve your own agency's scores and make sure that your patients are getting the care that they need.
So a good example of that is, again, back to catheter care. You've placed a catheter, you've instructed the caregiver, the facility, whoever, but then you can, in your EMR, document in your care plan under bladder or however you document it, refer to the hospice care plan for instructions given on catheter care. That's just one example, and it works really well. And I do want to back up on medications for 1 second. I think it's important. This section here on documenting PRNs and the bowel tracking form. I keep extra copies of this in my bag and hand them out as this page gets filled. And also remember to use a pencil on this instead of the scratch out, and just keep this routine nice and clean.
So we would also suggest that in this day and age, we know our staff is coming. You're always looking for seasoned hospice nurses. You're not always able to find nurses and caregivers who have had actual experience with end of life care. So we encourage you to use this as your orientation package when a new person comes to your staff who hasn't may be seasoned in other areas of care, but not in end of life care. So use that. We also have a 2 hour crash course video that we use as a primer for actual hospice care. It goes right along with the booklet, and you could incorporate it into your orientation. We'll also bring your staff then into the expectation that they will be using the booklet whenever they admit a patient.
And along with the 2 hour crash course primer, there's a lot of little videos on tips for the hospice nurse. It's the little things that are important and help create sustainability.
Even one, Brenda's got one. How do you pack your bag? What do you need to put in it to make sure you have everything? Because you can't run down the hall to the supply room when you need something.
Right. And people, and you're alone out there, and we all need support.
So the other advantage to your agency is that you can use this booklet as a marketing tool. I know we all live in communities that are served by multiple hospices. So when you're in a facility and there are multiple agencies being represented, this booklet is going to be recognized and it will be associated with your particular agency. Some of agencies will put a sticker of their own agency right here so that it also brands it specifically for their agency. So do use it as a marketing tool.
Yeah, and some hospices even we will brand the booklet for them. So good luck with using this booklet. Please contact us. If you have any questions about using the booklet, you can contact us at info@thehospicecareplan.com. And thank you so much for using our booklet.
Thank you.